Hello, and thank you for taking a look at our presentation today. My name is Lynn Duplessis. I'm a health and safety consultant at WorkSafe New Brunswick. And the purpose of this presentation is we'll be looking at the waste collection industry for what we call, or WorkSafe New Brunswick is calling, a Focus Industry Initiative. And throughout this presentation, we'll take a look at why we're looking at the waste collection industry for this initiative and what our proposed plan is. For our presentation, we'll be taking a look at WorkSafe New Brunswick's mandate, as well as our safety goal, the internal responsibility system. We'll review the analysis that we did on the waste collection industry, as well as its injuries, what WorkSafe New Brunswick's goal is for this particular initiative, take a look at the potential industry challenges that we've identified throughout this project, and what our proposed plan is for building a safe work culture in the waste collection industry. So a little bit about WorkSafe New Brunswick and its mandate. We want to promote the creation of a workplace safety culture in which all employees and employers view occupational disease and accidents as being preventable. On the right-hand side, you'll see some of the different team members or staff that play a role in this particular mandate. So the education consultants, health and safety consultants, ergonomic consultants, as well as others. We also want to promote an understanding, acceptance, and compliance with all legislation for which WorkSafe New Brunswick is responsible. This is including the enforcement of the Occupational Health and Safety Act and its regulations. And this is where the health and safety officers, as well as the occupational hygienists, play a role. We also want to provide timely compensation benefits, medical aid, rehabilitation, and safe return to work services for injured workers. Provide sustainable insurance and insurance-related services to the employer community, as well as represent stakeholders and provide recommendations and advice to government with respect to legislation. For the purpose of this particular initiative, we'll be focusing on the first two, which is prevention and compliance. Now, to achieve our vision of a healthy and safe workplaces in New Brunswick, WorkSafe New Brunswick's Board of Directors has established 6 measurable goals, one of which is a safety goal, which is our vigorous pursuit of a safe work culture that will lead to a decline in workplace injuries. So there are currently 5 strategies that have been implemented to be able to achieve this goal. Now, the first one, which is focusing on high-risk industries, is where this particular initiative comes into play, because the waste collection industry has been identified as a high-risk industry. But throughout this initiative, we'll also be touching on 3 other strategies, which is using the nature of injury to focus on prevention activities, building a work-safe culture through education and social marketing, as well as advancing safety standards in New Brunswick. Now, the workplace plays the biggest role when it comes to health and safety. The Occupational Health and Safety Act is based on what we call the internal responsibility system, which means that everyone in the workplace, both employees and employers, have a role to play in their own safety and for the safety of their co-workers. Your specific responsibility may depend on your role. And it doesn't matter what role you play in the company, everybody has a role to play when it comes to health and safety. So employers, supervisors, human resources, health and safety committees all feed into the internal responsibility system. Employees or supervisors monitor and discipline to ensure that employees follow the rules. Employees, if they identify potential hazard and risks, have to communicate them to ensure that they get rectified. Human resources ensure that staff get the proper training in regards to health and safety. So everybody plays a role. This is where health and safety starts. Now, the waste collection industry. So we did an analysis on the waste collection industry. At the end of 2014, there were 31 companies in operation that did waste collection in New Brunswick, with 356 estimated full-time equivalency, so that's full-time employees, which brings an average of about 11.4 per company. We also identified 7 municipalities that also carry out their waste collection. Now, when we did the analysis of this particular industry, We looked at the industry for waste collection. The municipalities don't fall into the same one, but when we looked at the municipalities, the accidents of the municipalities that do their waste collection, we identified that the types of accidents and the nature are similar than what we identified in this particular initiative. So we believe that, so we're putting a plan in place that will affect both. Now, when you think about 31 companies and 356 employees, it may not seem like a lot when you think about the province as a whole. But the reason that we're looking at the waste collection industry is the severity of the injuries and not necessarily the amount. Since 2003, there have been 4 fatalities in the waste collection industry. 2 in 2003, 2 in 2010. Both fatalities in 2003 were employees that were struck by a waste container. And that was one of the fatalities in 2010 as well. The other one is the employee was struck by a vehicle. In terms of number of injuries that were brought to WorkSafe New Brunswick in a claim, between 2009 and 2014, there were a total of 172 injuries. Now, when we look at the injuries, we look at lost time and no lost time. And the difference between the two is that lost time injuries means that the employee had to miss time from work because of the injury they incurred at work. So 91 of those injuries were lost time. 54 were less than 20 days and 35 were more than 20 days. And the reason we look at 20 days, and when we look at severity of claims, it includes fatalities, claims with immediate hospitalization, occupational illness claims, as well as a claim with a duration greater than 20 paid days. In this case, of those 35, 66% of those were actually over 60 days, with the majority of those actually being of over 100. Therefore, when the accident was severe enough to miss over 20 days, the recovery time was very long. So if you want to compare the industry to the province, what we do is we bring it to what we call the frequency. So we want to be able to compare apples to apples. So when we look at frequency, we look at how many injuries for every 100 employees. The green line at the bottom shows the province's injuries, and this is all injuries, both lost time and no lost time. So as you can see for the province, it went from 3.24 in 2009 to 2.89 of what the information we had for 2014. What this means is that at the end of 2014, there were, for every 100 employees in the province, there were 2.89 of them that incurred an injury at work. The frequency for the province has been on a downward trend since 2009. Now, if you look at the top line, this is the waste collection injuries, and this is, again, all injuries, so lost time and no lost time. It is 2.5 to 3.5 times higher than the province average. So, for example, and the highest was in 2010, where for every 100 employees in the waste collection industry, almost 10 of them incurred an injury. The amount of injuries went down from 2010 to 2011, but it has been, again, on an upward slope since 2011. And in 2014, with the information we had, 8.53. So for every 100 employees, 8.53 of them incurred an injury at work that resulted in a claim. Now, injuries by occupation. When you're looking at who in the waste collection industry is getting injured, 33% are listed as laborers or waste collectors, and 52% truck drivers. Now, what we know is that often the truck driver is also the person performing the waste collection. So 85% of the injuries account for those two roles. The remaining 15% are mechanic, welders, as well as managers and supervisors. Now, events that cause injuries. For companies, some companies may not have had a lot of injuries, and what we've identified is the trends occur across the board. So one thing to keep in mind is that if in your particular company you may not have seen these particular injuries, be aware that it's a trend that's seen across the board. So the hazard and risk is still there even if you have not seen it. And again, although we're not looking at the specific accidents that happen in municipalities, when we did an analysis there, we identified that those were similar. Now, the top right, the blue section, 26% of the injuries are what we consider bodily motion. So this could be lifting and throwing waste. It could be other types of movement, and twisting, repetitive movement as well. 10% injured by waste. This is the actual waste itself in for example, glass, needles, and those types of injuries. 20% was slip, trips, and falls. What we identified, though, with the slip, trips, and falls, you think, well, there's the slippery and uneven ground, but a lot of those were actually getting in and out of the vehicle or getting off of the platform. Now, the highest one was struck by or caught in. So this includes struck by an object, chemical, a door or a gate, caught in between a piece of equipment or an object, or struck against a piece of equipment or an object. And 10% vehicle, these are vehicle accidents. So a vehicle accident when someone was injured, or something happened within the accident that injured the particular employee. And this information is from our accidents from 2009 to 2013. Now, the nature of injuries, again, 2009 to 2013, 52%, so over half, were what we call soft tissue injuries. So this includes sprains, strains, hernia, other back injuries. 35% were cuts, lacerations, abrasions, and bruises. And 8% for fractures and crushing injuries. Although this one is low, this is where we see that there may be a very high severity in terms of the type of accident. And again, 5% were intracranial injuries and concussions. Contributing factors to the injuries. One of the things is when investigators or officers looked at either the fatalities or serious accidents, some of these items is what kept repeating in terms of contributing factors to the injuries. So there were concerns with the employees or the employer's awareness of health and safety practices, a lack of familiarity with the workplace risk factors, perhaps insufficient orientation and training, irregular vehicle inspections, and in the case of some of the fatalities, inconsistent pre-use inspection of mobile equipment. Now, WorkSafe New Brunswick put a team together to try to work on, now that we have the analysis, what can we do to be able to reduce the number of injuries. But first we wanted to identify what we wanted to accomplish. So as I stated, we certainly want to reduce the number of injuries in this initiative, but even more so is to reduce the number of severe injuries and fatalities. And we also want to promote a safe work culture within this industry. Now, potential challenges. As we understand that this particular industry, it's very small and it's diverse. So here are some of the challenges that we identified. The companies within the industry vary. They vary in the type of equipment that they use, in the number of staff that they employ. There are some companies that have over 20 staff, over 40 staff, but the majority have less than 10. The companies vary as well in terms of the clients that they service. Some do residential work as well as commercial, or one or the other. And these have different hazards and risks associated with them. As well as if you work in an urban or rural area, there is a different impact in terms of hazards and risks. Some cities and municipalities collect their own waste, so we need to keep that in mind. With the frequent contract changes, this impacts the employee workplace. So you have to remember, the workplace where the employee goes to work are the residences on their route, are the companies that they have on contract. And when these change on a regular basis, the employee may not get necessarily familiar, or they always have a change of employment or workplace. And this can have an impact on hazard and risk. And the industry evolves rapidly. The type of equipment that's been used 10 years ago may not be the same equipment being used now, and probably won't be the same equipment used in 10 years from now. As well as the areas change in terms of what they're looking for in terms of waste collection. Some areas require bins, some areas require a sorting system, which you have different types of bags. So they have to evolve and adapt to the different companies that they work with and the regions as well for what the municipalities are looking for. Now, in terms of our plan, so we talked about the findings in our injury analysis and the challenges, and we understand that the industry is different than what we may find in other types of industries. So this plays a role in how we want to work within this industry. So we've divided, let's say, into 2 or 3 different sections. First one is we want to work directly with the waste collectors. So these are the companies as well as the municipalities that collect their own waste. We also are looking at doing an initiative that works with the waste contract administrators. So the regional service commissions, local service districts, and municipalities that hire companies to do the waste collection for their areas. Now, for the waste collectors, because we identify that the companies are different and the number of companies is small, we determined that probably the best approach is to work directly with each company. So the first thing we want to do is we would send an education consultant to have an initial consultation with the company. And this is for 2 reasons. It's to be able to provide information about the injuries, about the initiative, about our plan, any other tools that we may have, but also to gather information from the company to better understand what their particular needs are. From there, we want to provide a workshop for each company where we can share information in terms of where the accidents are happening. They may not be aware of what's happening across the province, but may still affect them. Their role in health and safety, as well as other aspects. And once we identify the types of injuries, some suggestions on what they can do to reduce the risk of those particular types of injuries. And when we say adapted workshops, because we're going to each company specifically, we may, and depending on some of their needs, we may be able to adapt. Although we want to provide the same message to all of these companies, we may be able to adapt somewhat what our approach is or how we can present some of this information to them. We will also provide some education material to that effect. Now, with this particular initiative, we're looking at, because some companies are different, we may establish throughout our consultation that they may require additional types of consultation. For example, if some companies we identify as needing more ergonomic and manual handling consultation, we will send an ergonomic consultant to work with them. If they have a joint health and safety committee or a health and safety rep, we will work with that committee and that representative. If there's anybody interested in doing peer groups for their region, we would certainly look at that, as well as other services that we may identify. Now, these are all prevention initiatives. In terms of compliance, we've identified some aspects of the legislation and regulations that we want to ensure that companies follow. So because of that, we've identified some of the things that we want the health and safety officers to look at. But what we want to do, though, is provide that information initially at the consultation stage, is to provide that information of what the health and safety officers will be looking at during their visit, so that they can, if they identify that they have gaps, they would be able to work on those prior to an inspection from a health and safety officer. Our plan is to do the prevention phase, the consultation, the workshop, in the next couple of months, from May to September, and then start working with the officers with some visits in 2015 and some in 2016. But what we want to do, like I've stated before, is we want to be able to provide the information of what we want them to implement or what they should be implemented already, because it is part of legislation and regulations. But we want to, and these will be some of the sections that will be reviewed in the workshops as well. Now, for the waste contract administrators, we're looking at doing a consultation with these groups as well, and to provide awareness, both in terms of what are the different injuries that are happening in the industry, as well as what role they play because although they are not doing the waste collection, they are the one that are determining who's doing the waste collection in their area. So we're looking at providing information as to what they can do in the tendering process, or what they can do when they're contracting out or within their contracts to ensure and look at what these companies have in place for health and safety. Another piece of this initiative that hasn't been finalized yet, and we would need partners to be able to do this piece, is a general public awareness. As we also know that the general public has a role to play in the health and safety of the waste collectors, because they are going at residences, they are going on commercial property. So in terms of what is in the bags, how heavy the bags should be, how to dispose of anything that may be dangerous, where to put their bags or bins. These are all information that we'd be looking at providing with the support of the industry, because they are the ones that know this information of what we would communicate. So overall, this is our current plan of what we would like to do for this particular initiative, to be able to, again, reduce the number of injuries, reduce the severity of injuries, as well as promote a health and safety culture. Thank you very much for listening today.